So maybe we can start by talking a little bit about your leadership in the ACO, the Louisiana Physicians ACO. How big is it? How many patients? How many physicians? Give us a little description of the volume to value journey.
We have about 10,000 Medicare beneficiaries attributed and a similar number in our leading commercial group. Well, right now, we've got 5 major clinics and 5 EHRs.
So, and how important, in general, how important is data to accomplishing your volume to value journey?
One of the big challenges, of course, with running a network across the state is we do not have a unified EHR. And we also, because we're independent clinics, not hospital systems, we don't have a direct feed to the hospital's ADT feeds, other challenges like that.
So how does Innovaccer help with that?
So Innovaccer is helping us because they've got our data warehouse, they've got a data lake, and our feeds coming in from Medicare. Also, they're linked into our EHRs. They somehow figure out how to get into the back of the EHR system, like if you're digging around the back of a computer, and are able to pull data feeds from claims as well as other feeds from the national laboratories, also medications through their SureScript feeds. And by doing that, we're able to get a really good view of what's going on with the patient, what are their medicines, what's going on with their lab work, what other physicians are seeing, what other diagnoses are being managed that the primary care doctor may not be aware of.
Let's get to wellness for just a minute, and not just primary prevention, but secondary prevention. Tell me how Innovaccer actually helps predict which patients or which patient cohorts are most in need of intervention before they end up in the emergency room or before they end up in the acute care facility. How does that substantively work through Innovaccer?
So Innovaccer uses a set of analytics that will look at claims data, pharmacy data, diagnoses, and can predict who are your patients with rising risk. They can look at patients who have just started going to the emergency room, who in the previous year had not ever gone to the emergency room, and that will flag the patient.
So Josh, it's my memory that transactional EHRs really are not able alone to do the kind of outlier analysis that we're talking that has been enabled by Innovaccer. Is that correct? Is that your experience?
Right. The EHR system, think of it as a bookshelf.
Right. Or a pipe. Or a pipe.
Or a pipe, right. And if you go to a library, you need the card catalog. You have to be able to look things up. Innovaccer's software allows us to literally look things up. We're able to look across the network by physician, by clinic, by region. We're able to evaluate where we're missing out on wellness activity or where certain diseases are more prevalent or where the management of those diseases is less cost effective. One of the best areas in value-based care for helping the patients is improving that transition out of the hospital. So Innovaccer is helpful in that regards by having the ADT feeds that can come straight into our EHR.
So when you see that a patient has been a high utilizer, do you design your caregiving programs around that and change how to intercede based on those data?
So when we've identified a group of patients who, let's say they're more frequent flyers through the emergency room, people who are going to the emergency room for things that are not necessarily hospital level care. We're able to identify those patients and then try and figure out what intervention would be helpful. So Innovaccer has this powerful suite of tools, and for now, we are trying to catch up to their capabilities. Our goal really is just to get it implemented across our network, across each physician. Right now, there's more tools, more analytics, more reports than anyone actually could possibly use. but can we get the basics done right across the system? That's our goal.
Josh, it's really great to meet
Thanks,
you.
Glenn.
Thanks so much for your time. Keep up the great work.